The cat-cow stretch is one of the most commonly prescribed exercises in physiotherapy for back pain, and based on what physiotherapists observe when patients demonstrate it during initial assessment, it is also one of the most consistently performed incorrectly. When done correctly, it provides genuine benefit to spinal mobility and deep stabilizer activation. When done incorrectly, it wastes your time and, in certain presentations, can aggravate specific conditions. Let me walk you through the 4 most common errors and the precise correction for each one. Error 1 is speed. Most people perform the cat-cow as if they are trying to complete it and tick it off a checklist as fast as possible. The back flops down, rounds up, flops down. 8 repetitions in 15 seconds, and the person considers themselves done. At that tempo, the movement is driven entirely by the large surface back and abdominal muscles. The deep spinal structures, the multifidus, the interspinous ligaments, the facet joint capsules receive essentially no meaningful mobilization because the movement passes through too quickly for each individual segment to open and close in the progressive sequence the exercise requires. The entire clinical value depends on moving slowly enough that each spinal level participates sequentially rather than the whole spine moving as one unit controlled by the strongest muscles available. The correct tempo is 4 full seconds into the cow position, a 2-second hold at end range, 4 full seconds into the cat position, a 2-second hold, and then the next repetition. 10 repetitions at this pace takes about 60 seconds of active movement, and those 60 seconds produce a measurably different effect on joint mobility and disc hydration than the same exercise done in 15 seconds. Error 2 is segmental restriction, moving only the lumbar spine while the thoracic spine remains almost entirely immobile throughout the exercise. You can test this yourself. Place your non-dominant hand flat on your mid-back during the movement and feel whether it rises and falls distinctly as you transition between cat and cow. If the hand barely moves, the thoracic spine is not participating. This matters because the thoracic region is typically the most restricted and compressed region in people who work at desks, and performing cat-cow while consistently bypassing it means you are missing the area that most urgently needs the mobilization. To correct this, consciously think about the space between your shoulder blades opening and spreading apart as you round into cat, and your sternum lifting forward and away as you arch into cow. Keep exaggerating the thoracic component until it becomes an automatic part of the movement pattern. Error 3 is reverse breathing, inhaling during cat and exhaling during cow. This is physiologically backwards, and it prevents the deep core system from co-activating as part of the exercise. Inhalation naturally promotes spinal extension through the mechanics of the descending diaphragm, supporting the cow position. Exhalation promotes spinal flexion as the diaphragm rises and the abdominals naturally engage, supporting cat. Inhale into cow, exhale into cat, and when you coordinate this correctly, you will feel a different and deeper level of abdominal activation during the cat phase compared to the breath reverse version. Error 4 is performing the exercise when it is specifically contraindicated for your presentation. If you have an acute disc herniation producing sharp radiating pain down your leg, the cat position loads the lumbar spine into flexion and can increase intradiscal pressure at the herniation site, worsening nerve root compression. In that situation, avoid unsupervised lumbar flexion exercises until a physiotherapist has specifically assessed and cleared you for them. For everyone with generalized stiffness, postural aching, and mild to moderate non-specific back pain without leg symptoms, this exercise done correctly is among the safest and most effective daily habits you can build. There is also a 5th issue worth naming, which is not really an error in technique but an error in expectation. Most people begin the cat-cow expecting it to feel immediately dramatic, And when the movement feels small and subtle, they assume they are doing it wrong or that it is not working. If it feels extremely dramatic and large, the movement is probably being driven by the large superficial muscles rather than by careful sequential segmental mobilization. And that version, however satisfying it feels in the moment, is a less therapeutic one. The full guided demonstration with slow motion physiotherapist corrections for all 4 errors is in the link in the description. Watch it, then redo the exercise once. You will feel the difference between the correct and incorrect version in the very first session.